everyone. Today, we welcome you to the podcast under my health program. Today, we will be discussing about a very infamous disease, which is anthrax. Today, we have Dr. Mehak. She is from Veterinary Medicine, and she will be telling us some detail about the disease anthrax. Welcome, ma'am, to our podcast. Thank you so much for coming here. So, my first question is, why is anthrax considered as a serious zoonotic and environmental threat?
First of all, thank you for having me here.
Okay.
So let's first discuss why anthrax is considered to be an important zoonotic as well as an environmental threat. So anthrax basically is considered to be a most important zoonotic as well as an environmental threat because first of all, of its main important thing being the transmission cycle. That is of because of its importance being connected to an animal as well as human health. It spreads from animal to humans directly without needing any direct contact between human to human. So that is the first important thing. Second one being it's the durability of its spores. Its spores survive in environment for decades together, surviving the wrath of temperature, environment, sunlight, anything, desiccation. It survives for longer periods of time in the environment. Third thing being it's also used as a source of bioterrorism. So considering all these points, it becomes both a threat to human health, animal health, as well as environment health.
Okay, so how does anthrax spread? Like, how does it spread?
There are main sources. First, considering our first thing being animal health. For animals, the main source is the contaminated soil, and two main sources are there for them. That is the ingestion and inhalation. So, source being the contaminated soil. For humans, the main source of infection is the contaminated soil, or animals, or animal products, carcass, or the contaminated soil.
Okay, so
And basically, humans get affected by handling the infected animals or infected animal products or infected carcasses. That acts as a main source of infection for humans.
So how can it prevent this disease to human cases? How can it prevent that?
Basically, the main important thing, the first and the foremost thing that can help in preventing the disease is the regular vaccination, especially in those areas that are considered to be endemic in case of the anthrax disease. Number second is when we are considering anthrax, if we think some animal has died because of anthrax, we have to handle that animal very properly, ensuring we don't cut open the carcass that is suspected to be have died because of the anthrax disease. That has not to be cut open. Number third, there a proper attire has to be worn when handling that carcass. Number fourth, we have to properly bury that animal. Number fifth, if we are not able to bury that animal, we have to properly incinerate that animal. So these some measures have to be taken so as to prevent anthrax from spreading to human population.
So how does anthrax illustrate the triad of One Health?
Basically, it is one of the best example of the One Health concept. The first most important thing, as we know, is it is caused by Bacillus anthracis, mainly affecting herbivores animal. Main source of infection for them being the contaminated soil. From them, it affects the human population. The main source of infection for the human population being the infected animal carcasses or the animal products, and environment being the main source of infection for human population for decades together. And this cycle goes on continuing. An animal dies, it acts as a source of infection for the soil. Soil acts as a source of infection for humans. The cycle goes on. So when we see this cycle, it gives us an example that if we have to control anthrax, it needs a coordinated One Health approach to control this disease, keeping in mind the regular vaccination in endemic areas, the proper carcass disposal, the proper environmental cleanliness, and the proper awareness in the masses so as to ensure proper well-being of humans and the ecosystems they are living in.
Thank you so much, ma'am, for joining us today. Thank you so much for giving us your precious time.
Thank you.
And thank you for tuning with us. And I hope you learned a lot about anthrax today. So thank you so much.